The United States makes up 5% of the world's population, and it consumes 80% of the world's prescription opioids. Ladies and gentlemen, we are in the midst of a massive crisis. According to the Center for Disease Control and Prevention, more than 800 people a week are dying from opioid-related overdoses. An epidemic that is killing people at a faster rate than the HIV virus at its peak. And at the epicenter of it all is a drug called fentanyl. Today we're going to examine the new face of opioid addiction and the problems that it possesses. We'll start to take a look at what led us here, as well as the urgent action that's required in overcoming this epidemic. I think that we're all familiar with the dangers behind drugs like morphine or heroin. But I'm here today to tell you there's a drug that is far more sinister, and it is seeping through the corners of our communities. Chances are there's someone that you know that is being personally affected by this. So what is it? Fentanyl is a powerful and toxic synthetic opioid that was developed strictly for the use of terminal cancer patients. The United States Drug Enforcement Administration says that it's 100 times more powerful than morphine and 50 times more powerful than heroin. So potent that a lethal dosage is around 3 grains of salt. Upon research of medical records throughout the county, the Washington Post says that 24 of our nation's largest cities and their surrounding counties experienced a 600% increase in fentanyl-related overdoses from 2014 to 2016. This year, the state of Ohio alone is estimated to lose 12,000 people from fentanyl overdoses. And if this trend continues, 650,000 Americans will lose their lives over the next decade to fentanyl. That is the population of Baltimore. It is an equal opportunity killer, and it not only affects drug users, but it destroys the lives of their families, and it rips children away from their parents. You've heard the numbers. I think it's clear to see that fentanyl is an insidious problem, and it demands our attention. But how did we get here? Our nation didn't develop an opioid epidemic until there was a massive surplus of opioid distribution, and this started with the pharmaceutical companies. Research that was based on the foundation of public documents, Raycom Media fostered the national investigation that doctors play in the role in this crisis. What they found was shocking. From 2013 to 2015, 500,000 healthcare providers wrote 238 million opioid prescriptions. Last year, 200 million opioid dosage units were distributed throughout the state of Mississippi alone. That is the average of 70 dosages per person. And while this is happening, the pharmaceutical companies are paying the doctors some over $100,000 a year to write these fentanyl prescriptions. This corruption on our healthcare also sparked the illicit fentanyl manufacturing, as many states are now reporting fentanyl virtually replacing heroin. So we've uncovered the threat behind fentanyl abuse. And we see that it's being passed out like candy from the people that we trust the most. So now let's start to explore what can be done to overcome this epidemic. From a governmental standpoint, states need funding. Many states are lacking the funding when it comes to evidence-based recovery programs, safe houses, stronger prescription control. All of these things are detrimental to the way that a community can start to rebuild from this crisis. But there is something that you and I can start to implement today to help alleviate the crisis. Having an ownership in our healthcare is going to protect ourselves from being another one of those statistics. We need to take extreme caution when we are taking prescription drugs, especially when it involves pain management or painkillers. Not only do we need to employ ourselves in our healthcare, but we need to be able to have conversations and be able to spread awareness, as many people think that a pill is safe just because it came from your doctor. And as we've realized, this is just not the case. So now you know there's a problem in fentanyl abuse, that there's a threat behind drug dealers in white coats, and that part of the solution is instilling a literacy in our healthcare. As the opioid crisis continues to grow, one thing is certain. Synthetic drugs will continue to disrupt the safety of our community unless we form a collective consciousness in prescription drugs and the addictive risks that they possess.